Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Newer non-depolarizers include rocuronium, rapacuronium, cisatracurium, mivacurium, and gantacuria. 1. Rocuronium. Rocuronium is actually a derivative of vecuronium. It is one-tenth potent. Advantages of rocuronium are it is fast acting, that is 60 to 90 seconds. Normally, it acts for 3 to 4 minutes. Rocuronium is a non-depolarizer of choice for intubation. Rocuronium has no active metabolite. So, because it has no active metabolite, rocuronium is a muscle relaxant which can be used as continuous infusion in ICUs. Disadvantage of rocuronium is vagolytic in action. 70 to 75% are excreted in the bile, and this should be avoided in biliary obstruction.
Summary: Rocuronium is a derivative of vecuronium. It is one-tenth more potent and it is faster acting with 60 to 90 seconds. Um, and it is a non-depolarizer and it has no active metabolite. Because it has no active metabolite, it is the muscle relaxant of choice for continuous infusion in ICUs, and because of its faster acting agent, it is mainly used in intubation. The disadvantage is it is vagolytic, 70 to 75% are excreted in bile, and it is avoided in biliary obstruction.
thank you and thank you for watching.